evening, hello and welcome to this edition of the India Development Debate. I'm Nayantara working from home. Today we have a very special guest with us. She's a COVID hero. She's a frontline healthcare worker who probably hasn't had an evening off ever since this pandemic broke out. Dr. Sushila Kataria, the head of internal medicine from Medanta, joining us live on this edition of India Development Debate. Dr. Kataria, it's an absolute pleasure to have you on the show today. We're getting you at a time when the active number of cases for COVID-19 have started declining. The mortality rate is going down. The recovery rate is improving every single day. But we now have a cold wave, Dr. Kataria. It has snowed in Shimla, and we have been hearing and reading so much about what the cold wave can mean for the coronavirus. Can you talk to our viewers and explain to them what it is that they need to be extra careful about?
So, this is the good thing that the numbers are declining. But let me tell you that this is not the end of this pandemic. We have seen this in Europe, US, Italy, that, things start to get better and suddenly the wave starts to increase. Now, with the winters coming, people getting more and more into indoor places and, gatherings for the Christmas, for New Year and weddings happening. I am, worried that the numbers might start increasing by mid-January again. And now, because of the cold weather, people are not going outside. More and more people are living in smaller places, and especially those people who do not have, big houses and well-beings are small, areas are congested. The risk of transmission of this virus is more during the cold weather.
So is there anything extra that one needs to do during this cold wave? Or just social distancing, mask and all that we've been hearing about, that's good enough? We keep hearing also about our grandmother's remedies to boost immunity, etc. What should one do?
So first thing first, the basics are the most important things. So mask, proper mask, worn all the time whenever it is necessary, and social distancing, especially when somebody is sick. Please do not go outside and rest and take full precautions. Because I have seen people who are mildly symptomatic, they're very eager to go out and party. So please refrain from doing this. You do a good to yourself and to others also. As coming to the grandma's remedies, the grandma's remedies always work. So have warm soups, warm liquids are always helpful, good for your throat. Secondly, get yourself vaccinated for influenza, because these are the times the influenza infection is also on the rise. So having yourself protected from influenza is good in this season. So these are the main things. And whenever we will have COVID vaccine, we'll talk about that also.
But, we are entering 2021, Dr. Kataria, with a lot of hope and optimism when it comes to the COVID-19 vaccine. Of course, India still has to approve the applications, has at least 3 applications before it for authorization. But Dr. Kataria, the government has been quite clear. The first phase will be for the priority sector, all of those who are above 50 years old. My question to you also is, being 50 and above, is that good enough to get the vaccine? What I'm trying to get at, if you've had a decent run, for all those 50-year-olds who've been healthy during the lockdown, who've been healthy during 2020, how important and critical is it for them to be first in line or be one of the first few to try and get the vaccine?
So we know that from the recent study, it has been found that people above the age of 45, they are responsible for 40% infections, but 88% mortality. So age is the single most factor which is increasing the mortality, along with the other factors like diabetes, hypertension, obesity in particular. So I would suggest, yes, if vaccine is available for people and you are above 50 years of age and you are in a category that you are getting a vaccine, I am a pro-vaccine person. Vaccine would help. You should get, but it has to be a well-validated and a safe vaccine. Then one should get it.
Of course, for that, the Indian government, the regulators, the COVID-19 task force are looking into all of those issues. You said you're pro-vaccine. We have started seeing, immunization begin in the United Kingdom, United States, Canada, Singapore has got the shipment, all of that. We have been told that it's a matter of days before India will also give authorization. But Dr. Kataria, so you're saying age is the most important factor. It doesn't matter if they've had a good 2020. They should actually maybe risk that. And I'm asking this on behalf of viewers. We all have friends and family members who are above 50, right? They should actually risk going out, going for those camps, all of that to get the vaccine, even if they've been healthy?
So getting a vaccine does not give immediate immunity. One need to understand this completely. So vaccines, most of the vaccines are 2 doses, and the immunity, you can be pretty sure the immunity develops only after 3 to 4 weeks of the vaccine, or precisely first 6 weeks from the first vaccine and 2 weeks from the second vaccine. So getting a vaccine does not mean that you get an immediate immunity. The immunity will take time. You need to keep your basics correct. And whenever you're going for a vaccination, I don't think this will be kind of like huge camps and people getting vaccinated in loads and loads. It will be particularly planned that people do not crowd and they wear face masks and obey the basic rules and continue to obey those basic rules for the given period of time till the immunity develops. So for all those who are getting vaccines, my only humble request is that don't be complacent in your basics. Continue to observe basic precautions even when you have been vaccinated.
Okay, so viewers, please do take note of that. Now, Dr. Kataria, things have started improving. The numbers are speaking for themselves as well. A couple of weeks ago, it was an absolute nightmare to even get treatment or a bed in the National Capital Region. And you had internal medicine at Medanta in Gurgaon. Can you confirm for us, as the frontline healthcare worker, the strain, the bad strain that we have started seeing after Diwali, is that indeed behind us? Things have started improving. The strain of the coronavirus right now that's prevalent is not as dangerous?
Well, as far as we are concerned about this N501Y mutation, which is called the UK mutation in COVID-19, we have had only few selected cases, confirmed cases in India. So we can't really say how rampant is this in our country, but a robust virus surveillance program is really required so that we can pick up mutations. The virus multiply at a very, very fast rate. So having mutations it's a common thing that you have a mutation. And fortunately, so far, whatever mutations they have, one has been a particular of attention that it increases the transmission. We're still not sure that it is bad enough to kill more people or make them more severely sick. So that part is there, and I hope that's not there. But we, as our country, we should have a more robust virus surveillance system, which have been lacking. We do not know how many mutations might have happened in the Indian population as well. So first and foremost, we are concerned about this new mutation, but we are not horrified with this new mutation. Hopefully, this is not more deadlier. It is just transmitting more frequently. Thirdly, all the vaccines and medicines which we have already developed and we are working on that would still be effective for this strain also. But time only will tell how right we are, and hopefully we do not incur any such mutation which makes all the treatment discovered so far useless. So right now my view is that I am pretty optimistic that this is just one of those mutations and it won't affect the survival rates.
And doctor, like you're saying, we need to have a better tracking system also, that post-recovery, what has happened to the COVID-19 patients, because we have been reading in the press that there are certain side effects that come up later. We don't have enough data also right now, not just in India but around the world, when it comes to the possibility of reinfection. The data we have shows that it's remote, but it is possible. So the treatment has been the same from the beginning. For example, in the earlier part of the lockdown, we were hearing a lot about hydroxychloroquine, for example. So the treatment has remained the same?
No, in the last 10 months, we have revised our treatment protocol at least 4 times. So I think we're learning, we're improvising, and fast we are changing ourselves. That's how, we work with a new virus, with a new pandemic. So to start with, there was a lot of struggle for hydroxychloroquine. Then results came in, no, this is not very good. then remdesivir, plasma therapy, and steroids. So in the beginning of the treatment, I'm sure when we started treating our first lot of patients, there was this, understood thing that steroids are a big no-no because this would increase the superadded infection and all that. To which we have taken a total U-turn, and now we know that steroids are the really helpful things, but not always. You can't. There is a particular time of the illness when you start giving steroids, and to which patient. So all the treatments have to be personalized, and it cannot be given as a blanket to each and every person. And yes, the treatment is being improvised. More and more improvisations have been happening, and in near future we might come up with a monoclonal antibody, which is very, very effective initially in the initial phase also. But right now, starting from hydroxychloroquine, going on to remdesivir, and sometimes this lopinavir, ritonavir was also tried. Then we went on to plasma, then we went on to tocilizumab. So now it is more of a combination of different things which you try for a particular patient, and it has to be tailor-made for that particular patient. Each and every person will not be benefited by the same treatment.
Dr. Kataria, I'm going to make this my final question because we're running out of time. At the beginning part of the interview, you have urged viewers also to consider a flu shot at the moment. Earlier, we had also been hearing about if you are asymptomatic, stay at home, isolate, don't come to the hospital. You have a cold wave. During a cold wave, you do see people get fever. You do see, that viral also come about. Would that still be your advice, that you stay at home, isolate, or go to a doctor? What would your advice be?
So for vaccination purposes, yes, different hospitals have started an initiative of home vaccination program also. We do have one of our very robust influenza vaccination program where you can just walk in and, without interfering and without mixing with other people, you can get vaccinated in a kiosk and, you can go out. So very less chances of you incurring infection during that time. Secondly, there is a program where people, especially elderly, they can be vaccinated at their comfort of their house. So that kind of program is available with our institute, with other institutes as well. And secondly, because it's been a long time and people are having problem with non-COVID related issues also. So you do visit people. We do not want people getting sick because of diseases other than COVID and, having the consequences of same, but also keep your basics correct. Vaccine, I always say mask is the most important thing, and then social distancing, and limit your time which you spend in the crowded areas, be it hospital, be it a marketplace. Wear your mask from home, and when you come back to your house only, then you remove the mask. Do not eat in between, and you do not have to remove your mask to talk. You can remove your mask only if you are alone in that area.
Tips that we keep forgetting, valuable advice that we keep forgetting, and we have to keep reminding ourselves, but of course we've not grown up with masks, we've not grown up with social distancing, and that's when complacency had also set in. Dr. Kataria, I'd like to thank you for taking the time out for joining us here on this edition of the India Development Debate. Thank you also for being a COVID hero. We don't thank our healthcare frontline workers enough, and really appreciate you taking the time out.
Thank you so much. Pleasure is mine. Thank you, Nayantara.